it's a new role in the UK with medical model training for graduates in science and health-related backgrounds. And the purpose of the role is to provide a continuity of care for patients and to provide a stability to the medical workforce.
The idea of physician associates is that they're taught a bit about everything, and so they're quite good as generalists, which is why general practice is such a great setting for us to work.
So I work in a very busy acute medical department, so I work with medical colleagues, so doctors in all stages of training, from junior doctors to consultants, work with nursing colleagues, including clinical support workers, and then members of the allied healthcare professions team as well, so pharmacists, physios, occupational therapists, as well as office and administrative people.
It's amazing to see a smile on a patient's face when I'm able to bring them that satisfaction in managing their healthcare.
It's a very challenging and it's an innovative profession, so I think it's quite nice because it's so new in this country. There's no set way that it should go, and it's a great time to be a physician associate. There's a lot to be involved with. I've recently just started teaching at Sheffield Hallam University, and it's quite nice to be able to have that job variety, doing the clinical work here, but also giving some pearls of wisdom to the students that have started at the university.
Because it is a new role, people do sort of naturally ask what a physician associate is. And in terms of the patients that I see day to day, I don't have many patients asking me the sort of in-depth questions about what a physician associate is.
Going back to my laboratory experience, I came across a patient's sample of swabs. And this patient had third-degree burns and was brewing infections, and I wanted to know more about this patient. Unfortunately, being in a lab, that wasn't the case. I couldn't directly provide that environment. I looked into medical school. I didn't want to be a doctor. I didn't feel that I could commit myself to studying a number of years. I came across someone who was studying the physician associate course at Wolverhampton. And I looked into it, I read about it, and I thought, oh, this is interesting. So I still I have my commitments, but I can still work in healthcare.
So I think it depends largely on what that person's interested in. Obviously also what jobs come out at the time of qualification, the location of the job. So all the usual things that often affect people's choice in where they want to work. But for me, I always knew that I wanted to work in GP practice. I had a really wonderful GP placement when I was a student, and I just really enjoyed being that first port of call. So I was really determined to always work in GP, at least when I qualified, and then see where that went.
We are dynamic.
Rewarding, because the profession's so new in this country. It's really difficult to predict where it's going to go, and there are a lot of challenges ahead of us, mainly seeking regulation, but it's very exciting and I'm looking forward to seeing what happens next.